Hi, thank you for watching Podiatry Practice Mastery. I appreciate you showing interest in these videos, and they're coming out weekly, and I hope you have interest in them. Underneath this video, you're going to find some other resources based on the topics we've addressed. Also, we're putting together some group sessions you might be interested in. If you want to have more information of kind of developing and being part of a podiatry community where we talk about practice management ideas, I'd love for you to join us at the next one. The information is underneath this video. Thank you so much. Hello, and welcome to Healthy Living. I'm Dr. Donald Pelto, and I have Lynn Homisak. She is from Washington, and she is a specialist in helping podiatrists and other physicians with their medical staff. Welcome, Lynn, to the show.
Well, thank you, Dr. Pelto. It's my pleasure to be here, to be your guest, and to all your very handsome viewers, hello.
Great. So, Lynn, we're going to talk about kind of what your passion is and what you've been excited for a number of 20, 30 years and what you do. So tell me what it is that you're passionate about and what excites you.
Well, first of all, 20 or 30 years is a compliment. It's been actually, seriously, next year will be 50 years I've been in podiatry. So,
wow.
Yeah, I started when I was 3. I tell everybody that. But my passion, professionally, I guess it's helping offices be more successful through some management strategies that maybe they're missing from their practices, or some staff training, office efficiency. These are all things I really love. Personally, I'm a certified health coach, so I'm also very passionate about, healthy living. And sometimes the two collide, but mostly mentoring and coaching people in the health area and also in management area is what excites me, energizes me, yeah.
Now, Lynn, do you spend most of your time with the physician or with the office manager or with the staff, or who gets 80% of your time normally?
I think it's split up pretty equally. When I go into an office, I spend time with both. And in fact, the doctors kind of are startled. They, I don't need the help. My staff needs the help. So I follow them into the rooms, and there's a lot of advice that we can give them on how they communicate with their patients as well, and what management strategies they can use to make their staff more efficient. So we do work on both areas.
And most of the work, I know we're kind of amidst where we're stuck at home doing these interviews and things like that. Is most of your time spent in the actual office with the client, or is it done virtually? How is
Well, now, in the midst of all that's going on, it is a virtual communication that I have with them, which is not as effective, I'm afraid, because I like being one-on-one with them and showing them what to do, and seeing what they do is very important, because then we can make some changes along those lines. But we're still working at it through the virtual means.
So let's talk before the virtual means, though. How is a typical week? Do you do like with groups of practices, one-on-one? Do you spend 2 or 3 days, or go there for 1 day? Because if it seems like if you're coming to see someone in Boston here, you'd have to come for a couple of days to make it worth your while.
That's exactly right. If I work with a client one-on-one in office, I should say, because sometimes there's multiple doctors there, I have to go in there and spend about 2 or 3 days with them to see how they operate, how they function, how the office functions, where's the flow back up. And so just analyzing a lot of the different things that they're doing, then we work from there on making it better. And then following my visit, I work with them for another month at home. So we still have that communication via WebEx or telephone, and they're able to contact me if they have any questions about what we've implemented. Yeah, so it's an ongoing thing, really. And even now, like I just got a call the other day from someone that I was in his office 3 years ago, and I have no problem helping them out and making sure that they're doing, the things they're supposed to be doing.
Well, that's what I was going to say, Lynn. When you talk about habit change, being a health or a life coach, changing habits, a practice has habits, and changing those, you can't just go in and give them, okay, you have to do this. There's no way. So do you have some type of a follow-up that you do? You said it's a month. Is there a monthly meeting? Is it, some type of coaching?
Yeah, we do. We make sure we implement or suggest the implementation process to them. It's up to them. Like I said, I think one of the problems that I have with offices that are kind of stuck in the way that they do things is that they don't want to change for whatever reason. Maybe it's fear, or things are too hard, or they're just not motivated to do it. But we do follow up with them after I leave to make sure. We have phone calls, and I mostly talk to the staff at that point, make sure that they're following through with some of the things that they're doing. And then the doctors will contact me. We'll have one-on-one with them as well. But yeah, I just hate leaving them, say, you have to do this and then goodbye, and, you're on your own. Yeah. So I do follow up. Yes. Okay.
Well, let's go back to kind of the beginning of, 20 years ago, when you were 3 years of age, when you started doing this. And how did you get interested and then become an expert about staff training? Were you in an office? How did that work?
Well, first of all, expert has such a nice ring to it. Thank you for putting me in that category. But honestly, Don, I feel like I've been one of the lucky ones. I started out when I was 16 years old. And I had worked for a doctor in New Jersey, and he was just starting out as a practitioner. I was just starting out as an employee. And we worked together. We had the philosophy that I don't work for him, I work with him. And the team just built from there. We had goals, we set our goals, we met our goals. And I had the opportunity to wear all the different hats in his office, having worked for him for about 32 years. So I was an employee, I was a manager, I was a clinical medical assistant, I was a receptionist. So I kind of fit in all the areas that they needed. And from there, from my experiences, from my knowledge, from what I've learned, I've been able to bring it into other offices and help teach them. Wow. And teaching, by the way, is one of my passions for what I do in both areas again.
Yeah, I can see, because you write a lot of, I think you're one of the most prolific writers, and you write because you love to teach.
Yeah, in fact, I did teach. It's funny. I was called to author a curriculum for a podiatric medical assistant course in New Jersey. And it was combined with a medical assistant course because no one wanted to sign up for the podiatry portion of it. So they had to mix it with a medical assistant course. And I walked into the class, the students there were about 18 of them. They resented having to learn podiatry. All they wanted to know was medical assisting. And so I walked in and they had their arms folded and I will not touch feet, I will not learn podiatry. And within a couple of weeks, we were both on the same page. They were enthusiastic. They thanked me at the end of the course, and 4 of them actually went into podiatry. And they did touch feet, by the way. So it was, teaching has been, my love and my passion moving forward from that particular time. So
yeah, wow.
It was really fun.
And then in terms of, there's a passion where you were doing it in the office with your provider there and with the other staff. How did that go, kind of transfer in? Like, why are you so passionate about training? Why is training so important? Why not? Why aren't people, don't they know what to do? Most people have successful practices. They're probably doing okay. Why do you have to train them?
John, I see the difference it makes. Okay, I see the difference it makes between an office that has untrained staff and an office that has trained staff. And yes, I realize it's very time consuming. The doctor doesn't want to spend that kind of time training. In fact, what they do is they pass it off to a skilled medical assistant in their office, or a skilled staff person. But what I've learned is that skilled staff person may be excellent at what they do. They may not be the best teacher. And so they take shortcuts, or they don't teach them exactly the way they need to learn. And so I think that with having a better staff and a more trained staff, well, let me put it this way. I had the opportunity to sit in a seat of a 737-500 Boeing simulator. Mm-hmm. Okay, so I sat in the pilot seat and I looked around me, and all I saw were gadgets and levers and buttons, and the only experience I've ever had in the driver's seat is sitting in a car. Yeah. So this kind of overwhelmed me, and I looked at it and I said, how does a pilot know what to do with all these things, all this instrumentation? And the answer is simple. It's like someone guided them through it. Someone taught them what to do with that. They led them, they took their hand, and they taught them every single thing that they needed to know for passenger safety, end of line. Well, what we teach our staff people in offices is for patient safety. Mm-hmm. And you just don't let a staff person go out and do some patient care, hands-on patient care, without feeling that they're qualified and you're confident that they can get the job done.
Yeah, yeah. And
so it all boils down to that.
Yeah, we want to take care of our patients.
We do.
But then there's the patient care aspect, but then there's also the, I guess you could call it the patient experience aspect of how to have good customer service, because it's not just about doing the job, but you have, do it.
That's exactly right. Yeah, I mean, patients don't want someone working on them that they feel is not going to do a good job for them. And so they want a professional. And I think with a trained staff person, they become a professional for the practice. It makes the practice look good too as well.
And so that kind of answers the next question: is having a trained staff really important? It sounds like it is very important. And, so I guess the whole adage of just taking the most experienced one and having them train the rest isn't, the best option.
No, I think that the doctor has to spend time with them. And what I have found is the best training process has been for a new person coming into an office to actually follow the doctor around. I learned so much from the doctor. I watch him, go over x-rays, and I learned terminology and bones of the feet and for podiatry. Mm-hmm. And what instrumentation they use and how patients ask questions, how the doctor responds to those patients. There's so much you learn just from watching the doctor. So what I always recommend is have a new staff person follow the doctor around for at least 1 or 2 weeks, mm-hmm. until they become familiar with how that doctor works. And they learn, so much about the practice from watching the doctor. And then, of course, you follow your staff person around with what you're going to do, let them teach you as well.
Yeah. It just seems like so many people or practices, whatever specialty it might be, they almost are like practicing on an island.
Yes.
And they're alone. How can people, and certainly they could hire you or they could go to a course, but it seems like, is there any community for medical staff or podiatric medical assistants, or they can answer questions? Is there forums? How do people, get answers to questions? It seems like everyone's so isolated. It doesn't really exist, does it?
There's no real formal training for podiatric medical assistants anyway. Mm-hmm. But I mean, there's literature, there's resources, there's magazines, associations and organizations that they can look into. There's me.
Yeah. And I think, well, because I think this is something that is true. You probably know this from the coaching, is that you could learn as much as you want, but if you can find one person that can help you, you can just save like years of frustration and headaches.
I mean, they almost become a mentor to that person, which, if they don't have, and that's another thing every office should have, is some kind of mentor for a new staff person coming on, orient them into the practice, and have that. It's comforting to a new staff person to know. As I said, that pilot, it's the same thing for a staff person when they come into an office. They don't know what's going on unless someone teaches them, and telling them is not teaching them. You really have to spend time going over it with each individual specifically.
Wow. Yeah. And why do you feel that some practices aren't as efficient as they could be, kind of going away from the training aspect and going into more efficiency, and how could they be more efficient?
Well, let's see, I think there's a couple of different reasons. First of all, every practice is different, okay? So I can go into an office and they can already be efficient, but there's still more things you can teach them to be more efficient. I think one of the things, as I said earlier, I think you mentioned it earlier, is they get stuck in doing something just one way, and they don't want to move out of that way. And I tell them, look, you can either go backwards, you could stay the same, or you could move forward. And I'd like to see you move forward. So let's implement some management skills, which, not to belittle doctors in any way, but they haven't learned management. You go to school to learn to be a doctor, okay? And so that management portion, whether it's managing people or managing your office, is a little difficult for them. And they usually, if they don't hire somebody, it kind of just doesn't work very well for them. And so they're lacking in those management skills. But then there's a hiring portion of it too. I think normally when I see doctors hiring, it's because someone left the practice and they have to fill that position right away. So it's a rush job. It's I need another pair of hands right away. Let's get through this. Let's just hire the first person that walks in the door pretty much. And I think that's a big mistake. I mean, I think that they should take a little bit more time in vetting that person and making sure that they're the right person for the job. They have the right personality. They can train for skill, and make sure they're put in the right position once you do hire them.
Yeah, those are some great tips.
Yeah.
And in terms of what are three principal approaches you would recommend that you found successful for boosting productivity in a practice? What are some takeaways that people that are listening to this, they could apply? And then once you talk about what they can do, how do you implement them?
Okay. There's you asked for three. One of them is having predetermined protocols. And clinical treatment protocols, yes, for sure. But also operational protocols, how you do things in the office and how you know that they work well and what doesn't work well. I know there's a lot of doctors that would question the fact of having treatment protocols. They say they're too rigid, and every patient is different, so they need to be able to not follow that protocol but bend a little. Absolutely. Any doctor knows that their symptoms are going to maybe not fit that particular protocol that they have, but it does help the office run more efficiently. It helps the staff person know what to prepare for the doctor, whether it's instrumentation or how to prep the patient. So it's very helpful to have those protocols in place. The second thing is patient scheduling. I don't think that the scheduling that goes on in many offices is basically, if I have 6 blocks, I'm going to fill all 6 blocks so the doctor doesn't get angry that I haven't filled the schedule. But they need to align a little bit better what that patient's coming in for with timing, so that the patient flow is better. So I think that there's a whole program on patient scheduling that we can go into, but we'll save that for another time.
Yeah.
And then the other thing is, what did I have? Oh, communication. I think if you ask me what there's one thread for inefficiency in every office, it's the fact that there's a lack of communication, whether it's between the doctor and the staff, between 2 doctors, between 2 staff people, between the patients and either one. And I think that that's a really big problem. I've had staff people come up to me and say, the doctor doesn't understand. Did you talk to him? No, I can't talk to him. There's your problem right there, is that you have to have that communication in order to solve some problems that are going, or some issues in the office.
Now, let's talk about some kind of then solutions. If the problem is not communicating, do you recommend, or what frequency do you recommend, staff meetings with just the staff meetings with the doctors? Is there a certain, I'm sure you probably have your own format of how it should be arranged and things like that.
Let's start right with what you said. I mean, let's put in some better measures of communication, because the offices that do not communicate, and I can tell you, I can walk into an office and within a half an hour, I would say even 15 minutes, I can tell that if this office is communicating or not. It's the body language, it's the attitudes that they have, it's the confusion that's happening in the office. There's no smiles on their faces when I walk in the door. And if I'm noticing it, patients are noticing it. And so, it's usually these offices that don't have staff meetings at all. They don't want, it's not time productive for me to have a staff meeting, or performance reviews. They refuse to do those. Meanwhile, then the staff and the doctor have no connection as to what they need to learn. So it's those little kinds of things that if they started implementing, huddles in the morning, let's review the schedule, let's see what's going on, they can have a better idea of how, better flow within the office. So.
And let's go and talk about, let's say after someone maybe listens to this, or let's say they read one of your articles, or read some books that are out there, or, whatever. The big challenge, and this is kind of going with your background in coaching, how can you make changes based on what you learn? I'm just going to throw out a couple of things. Can you do multiple things at once? Should you focus one at a time? Do you know of any tips, techniques? Because changing habits are really hard. And even as simple as a habit of a monthly meeting, or, explaining or setting up protocols, all these things are very easy to say. Like, you could give a list when you go into every office and say, you have these 500 things to do, but they're just going to go into what I call the gap. They're going to be like, this is way too much, way too overwhelming. The practices that you see implementing the best, what you talk about, how do they do that?
Yeah. Usually when I come out of an office, I'll write some kind of a report for them. And in that report, they'll be like, it could be up to 50 things that I think they need to change. And they look at that and they say, are you kidding me? There's no way I'm doing that. And I agree. So I tell them to take the top 3 things out of there that they think they can start right away, and put those on paper and start working on those one at a time. I think one of the biggest complaints I get are from staff who come to meetings, who come to training workshops and whatever that they do. And then they go back to the offices and they're excited and they're energized and they want to put some of these things in practice. And of course they meet with a little bit of, negativity from their doctors. Like, again, change, we've done it this way. It's worked this way for us. We're not going to change. But it's not working. So let's try something else. So I tell staff, tell the doctor, let's try this for 21 days, because that's how long it takes for change to happen.
I like that.
Supposedly, scientifically. Let's try this for 21 days, doctor. If it doesn't work, we'll go back to the way we're doing it before. And that kind of gives the doctor a little bit of, okay, well, I have an out. I will give them their due. I made them go to this session. I paid for them to learn something new. Let's try it. And if it doesn't work, then I have the out and we'll go back to the way we're doing it before. But sometimes, it lasts. And then they say, yeah, this is working out better. So let's stick with it.
Right. And then, or let's try something else or something else.
Or then they'll try something else. And sometimes it's a combination of both. I won't take the whole thing that you taught me, but this little piece will work really well in our office. So that's fine. I'm okay with that, as long as they make some change.
Yeah, that's great. Well, great, Lynn. I just want, before we finish up, I want to have everyone that's watching, if they want to learn more kind of about what you do and your work that you've written about and things like that, where can they find this information to learn more? Maybe, I think you have a lot of staff tips on your website. Where would they get that?
I do. I have my website is www.soshms.com. You can go there. I also put some tips and correspondences on my Facebook page, which is SOS Healthcare Management Solutions. So feel free to visit. I'd love to have new visitors there and join with me. Yeah.
And I think there's always people that are in practices. And I think we were talking about before about being on an island. People don't have to struggle by themselves. If they're struggling, probably other people have gone through the struggle as well in the past, and you or someone else can help them. If they want to do that, do you allow people to email you or ask a question, or how does that work if they have a simple question?
Yeah, please email me. There's no charge for emails. And in fact, what I do is if you're interested in just learning a little bit about what I do, we can set up a 30-minute conference call. That's also complimentary. And we can learn, and I'll give you some suggestions right off the bat, and then if we want to take it from there, that's totally up to each individual doctor or a client.
Yeah, that's great, Lynn. Well, thank you so much for your time and for doing this interview.